Insulin resistance. It is a condition where body tissues like muscle, liver, and adipose show a reduced biological response to insulin, leading to impaired glucose uptake and elevated blood glucose levels. Pathophysiology. Normally, insulin facilitates glucose uptake into muscle and adipose tissue while reducing glucose production by the liver. In insulin resistance, these actions become impaired, leading to decreased glucose uptake by peripheral tissues including muscles, increased hepatic glucose production through gluconeogenesis and glycogenolysis, and enhanced breakdown of fat stores. This results in hyperglycemia, and the pancreas compensates by producing more insulin. Causes of insulin resistance. The most common cause of insulin resistance is obesity, particularly visceral or central obesity, which is associated with increased levels of free fatty acids and inflammatory cytokines that interfere with insulin action. Genetic predisposition also plays an important role, with individuals having a family history of type 2 diabetes being at higher risk. Physical inactivity contributes by reducing glucose uptake by skeletal muscles. In addition, certain hormonal disorders such as Cushing's syndrome, acromegaly, and polycystic ovarian syndrome can promote insulin resistance and impair glucose metabolism. Additional causes. Additional causes of insulin resistance include certain medications such as glucocorticoids, atypical antipsychotics, and protease inhibitors, all of which can interfere with normal insulin action and glucose metabolism. Pregnancy is another important cause, as placental hormones naturally induce a state of physiological insulin resistance to ensure an adequate glucose supply to the developing fetus. Important clinical conditions associated with insulin resistance include type 2 diabetes mellitus, metabolic syndrome, polycystic ovarian syndrome, and non-alcoholic fatty liver disease. Significant consequences of insulin resistance include hyperglycemia, hyperinsulinemia, increased risk of type 2 diabetes, cardiovascular disease, and dyslipidemia. Management of insulin resistance primarily focuses on lifestyle modification, including weight reduction, regular physical activity, and dietary control, all of which help improve the body's response to insulin. Pharmacological treatment may also be used when appropriate, with insulin sensitizing agents such as metformin and pioglitazone helping to enhance insulin action and improve glucose metabolism.